True aging starts between 35 and 38.
35,
By the
38.
time you are...
For males and females?
Absolutely. There's a difference between preventative care and longevity medicine.
How do you incorporate this into a seamless lifestyle where it becomes organized, order, and it can be joyful? Because if not, it just becomes like more tasks. We don't need more tasks, you know?
What is NAD? Nicotinamide adenine dinucleotide. We need NAD in all of those.
Okay.
So if you are deficient, you're not making any energy.
So we know that NAD is super important, but again...
Now what do we do?
Yeah.
All right, so good. So we want to boost...
And which one works?
Well, that's
injections,
so
nasal
okay.
sprays, suppositories. I mean, skin creams. There's...
The DNA is one of the issues with mitochondrial aging, right? So it just gets wounded way faster because of the toxic environment. Okay, so what else goes wrong with your mitochondria? It is run by...
I just want to make sure, because I haven't had the time to be quiet, transparent, to read your book 100%. I've read the summary. Is it with this same language that you're talking about, or is it a little more simplified?
So the book is simplified, and there's a lot of really bad jokes in it.
Okay.
Thank God.
Yeah.
Okay, thank
Yeah.
God.
Yeah.
Do
And
you have one for the geeks?
It was actually...
Because I would read the geek
It was
one.
actually not bad.
Right, so I'm actually
Because I've heard you speak, and it was like...
Yeah.
Sorry.
When we met you on stage, it was, whoa, I feel stupid as hell. I thought I was smart.
Which, by the way, and I just want to sort of create a little space where we can address some of the, popularity, especially with certain supplements like NAD. Right?
Yeah.
Which is
so
for
okay, so
medical
this is a
consumption.
perfect spot for this.
Yes.
Right. So NAD. So anyway, so many questions to answer at one time. There's book one
We were
and two.
talking about the seven
No, I know.
pieces.
I know. No, I
Okay.
got that. So I was just going to say, so book 1 and 2 are written so pretty much anyone can understand it.
Yeah.
I am presently writing 3 and 4, one of which will be very scientific and detailed because people want to know.
Yeah.
And the other one will be...
You've already graduated.
And the other, right, exactly. And the other one is going to be very much simplified.
Right.
So I'm writing it in parallel.
It's almost like an outline, sort of?
Yeah, sort of like
Right.
with better, more simplified, so that anyone can understand this stuff.
course.
Because granted, we all live in a different world, and I know a lot of people with not exactly the same scientific background still want to understand.
Yeah.
I know, and you're contributing to the scientific community, which is important to
For sure.
keep expanding it.
Right. Okay. So anyway, so another thing that goes wrong in your mitochondria is an NAD deficiency, and this is huge.
Yes.
Okay. So what is NAD? Nicotinamide adenine dinucleotide, right? It can be used in 2 different ways. One of which is like oxidative reductive reactions. All right. Basically, it's just floating protons and electrons around. It just carries them, drops them off, carries them, drops them off. And I love this little tidbit. So everyone writes it NAD plus, right? So if you
NAD
actually...
plus and NADH.
Yeah, I'm
So
aware
we're
of
here
that.
all the time.
Right. And if you look at the molecule, it's a negative.
It's a negative.
It has 2 negative phosphates. So the molecule as a whole, it's 2 negative phosphates and 1 positive. So all in all, the molecule is negative.
It's a negative, right?
It is.
2 for 1.
Yeah. So I don't know why it's got a good publicist. Made it positive.
Wow.
It's
It's
really
almost
nice.
like vitamin D is
So,
a hormone,
yeah,
but they call it a vitamin.
Yeah.
Yes.
Now,
Spot on.
correct me if I'm wrong, because we did, some research. We, talked to Dr. Jin from Ginfinity, and he taught us a lot about NAD products, because there's a difference between the, marketed NAD IVs and injections, which in our experience, when we measured the levels, they didn't really work, versus a first step precursor like NMN, nicotinamide.
Well, actually, before you answer that, I was going to echo, we have 5 steps to it.
All right. So let me explain this really briefly.
Yes.
Okay.
So many questions.
I know. NAD is complicated.
We're going to have like 5 episodes with
I
you.
know, I'm sorry. I know. I'm
For
sorry.
real.
So
All right, come on.
NAD. So step 1 or use 1 is passing protons and electrons around, right? And that's all mitochondria.
Okay.
Okay. The second thing is that we rip the molecule in pieces.
So while on this concept, I just want to create a little space for the average viewer. When we're talking about mitochondria, there's so much interest now and so much popularity around a supplement, called NAD, right? NAD, and Miguel and I have done a lot of research on this, and we found that there are differences between, in the famous IV infusions of NAD, injections of NAD.
Yeah, and you got
versus
tryptophan, nicotinamide, niacinamide, nicotinamide riboside, and nicotinamide mononucleotide.
Versus taking like a first step precursor like NMN. So can you break that down for us?
Absolutely. So let's think about what NAD does first. And there are two basic ways of thinking about it. Step one is that we use it as a proton shuttler. Okay. So electrons and protons stick to it and it just dances around. The molecule itself remains intact. Okay, that's step one, and that's why it's important for energy.
So it's supporting the electron transport chain.
Correct. So it is part of the electron transport chain. It is part of the Krebs cycle, which is chemicals that live in the middle of the matrix, and it's part of glycolysis. Yeah. So taking a glucose molecule, turning it into something called pyruvate that then goes to your mitochondria,
which that's the glycolytic pathway versus the citric acid pathway, which is different.
Correct.
Right, and that's a little engine inside the mitochondria.
Right. It's providing the fuel for the mitochondria to make your energy.
Yeah.
Right. But the point is that we need NAD in all of those. Okay. So if you are deficient, you're not making any energy. Right. All right. But then, so that the molecule stays intact. Over here, we're going to chop that molecule up and use it for other reactions. All right. There are 500 other reactions where we need NAD. Wow. The big ones are sirtuins. So sirtuins, which we haven't gotten to yet, right? They control all cellular homeostasis. Yeah. There's 7 of them, blah, 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 blah. But without
most of the studies like one on SIRT1 and SIRT3?
SIRT1, 3, and 6 both basically take care of longevity.
And just to be clear, if this is correct, sirtuins fuel this. NAD fuel the sirtuin genes, and then resveratrol sort of help to activate them, or that's David Sinclair's thing.
Right. So so all the sirtuin-1 activators, it's mostly resveratrol, pterostilbene, and ferroparaflora, which I can never say correctly, activate sirtuin-1. But as a cofactor for sirtuin-1, it has to have the NAD molecule. Right. It is called a necessary cofactor. Right. And what it does is it takes off, basically decapitates the NAD molecule, removes the nicotinamide part, and puts the lysine, because it's a lysine deacylator, but it has to use it. All right. Second important thing is for something called PARPs. Okay, PARPs.
Yes.
There are 17 PARP families. The big one, PARP1, is used to fix your DNA. Right. And if you don't have sirtuin, or if you don't have NAD, your PARPs don't work, you're more likely to have DNA damage, which means you're more likely to get cancer.
And you have more PARP as you get older, or no?
You have more need for PARP.
More need for PARP. Yeah, sorry.
So when you are NAD deficient, your energy goes down, your sirtuins go down, right? Homeostasis, as well as increased risk of cancer, right? Now, there are other enzymes that use NAD, but those are the big ones.
The big ones.
So another way,
so DNA repair and energy. DNA repair and energy are the huge
So
ones.
essentially, we all know that after the age of 40, your NAD levels start to decline. Yeah. Why? Because you use more. You've got more DNA damage. The enzyme is, so you need more and you make less because the enzymes that create it are declining. Right. All right. So the shift is terrible, right? Have less, need more, increased risk of disease and morbidity.
So could I give you an analogy? Because I think it's important for the viewers. The analogy I usually use is, just like we always use, if you had a company and you lost 50% of those employees, you still have the same demand, and you now have to prioritize more crucial jobs than others. And eventually that's going to start decreasing the productivity of that company, ultimately collapsing it. In the same respect, we need NAD. When we start losing NAD, your body has to prioritize whether keeping your heart beating or maintaining your hair from graying or maintaining a healthy collagen production in your skin. Which one is more important, right? So we go from having, this is just an anecdotal number, but from trillions of crucial functions down to the billions, accelerating that aging process. Is that
that is spot on.
Okay.
And I will tell you that it has to do with binding affinity, which one goes first.
Right.
Okay.
And sirtuins go first.
Yeah.
Because that's just the way it works.
Yeah.
And as a consequence, you lose cellular homeostasis before everything else.
Yeah. So we know that NAD is super important, but again.
Now what do we do?
Yeah.
All right, so good. So we want to boost.
And which one works?
Well, that's
injections, nasal sprays, suppositories. I mean, skin creams. There's so many ways. You know?
So the question first is, which one?
Yeah.
So you have to understand the pathways. Okay. You also have to understand how we make NAD. NAD is a circadian product.
Yeah, and that's how we
blew us away, and you
Right?
deserve so much credit for that.
Yeah, you blew us away with this.
So NAD is created in a circadian pattern, and it controls circadian patterns. So it's a little inbred, which means the half-life is very short.
Right.
Okay. So again, we'll get to the IVs, but I'm not a fan because dumping a whole lot in, it's just going to go poof, and then you're stuck with the metabolites that aren't so great for you.
And that's where you get the flushing effect, all those side effects, and then people feel better once it goes away, and they're like, wow, I feel so much better. It's like, no, you just like literally produce toxicity in your body.
Yeah. Okay. So NAD itself cannot get through any cell membrane, except neurons.
Yes.
All right.
Wow, so it does get to your head. So
it can't.
So intranasal sprays might just do.
So that's possible, right? But it can't get through the cells to get there.
Right.
It just can't. It can't get through intestinal
It's
cells.
too big of a cell. It's sort of like too big of a cell to penetrate.
It's not. It doesn't have receptors.
Okay.
Receptors are
So
like
it can't
a door.
bind. If you can't bind, you can't transport around the body.
Exactly.
And peripherally, you can't get to even to the brain.
That's correct.
Okay.
What does have receptors? So if you look at the natural pathway of NAD, when NAD gets broken into pieces, right, it goes into just NAM, which is straight up just
What's the word
nicotine.
you just said?
It's NAM.
NAM.
That's just
NAM.
NAM. It's just NAM, which is actually just the nicotinamide molecule.
Okay.
Then you've got enzymes that turn it into NMN, and then you've got enzymes that turn it back into NAD.
Which is the NAD salvage pathway.
Right, it's the salvage pathway. So we've got, right, it gets broken down, NMN, back to NAD. Doop, 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 doop.
And a lot of the theory is that the NAD salvage pathway becomes dysfunctional, and
It does, because the enzymes become dysfunctional.
all right.
Okay?
Okay.
So you could say, well, increase your enzymes, and you can actually do that. It turns out that EGCG from green tea increases some of those enzymes.
Right. Wow.
So that actually
And it actually activates AMPK.
it does.
I take green egg. We
take green tea
Yep.
in the morning because your catecholamines drop, and it activates catecholamines by
Yep.
raising it. And it's a potent antioxidant.
And it also helps people lose weight, and it's an epigenetic modifier. So, thumbs up to green tea. Okay, so that's the basic thing. So people go, oh, I can just take the NMN.
Right.
That's fantastic. However,
You're leaving all these other components out.
some tissues don't like NMN. In fact, some tissues are toxic with NMN. If you have any nerve damage and you have high levels of NMN, you have axonal degeneration.
A what?
Axonal, so part of the nerve cell
of the nerve cell,
right,
okay.
can actually degenerate if you have high levels of NMN.
Oh, wow.
So you don't want high
When you mean
levels.
high levels, because in Jin's test, he wants to maintain anywhere from 40. Well,
No, he's asking for NAD. He's not looking for NMN. Right?
but taking the NMN product, the NAD levels go up.
So hear me
Which
out.
we don't know what he's really testing, because then we tested Ryan Smith test as NAD. We came out optimal on the Jin, but not Ryan.
We'll get to that in a second.
Too much.
All right,
Too much.
We'll get to that in a second. All right. So NAD goes to NAM, NMN down to NAD.
Yes.
You could take the NMN,
Okay.
right? But you don't want monster doses because it can be toxic.
What do you consider a monster dose?
That depends on the person.
Okay.
All right. Now the other option is taking NR, right? Nicotinamide riboside.
Which those
right?
are the ones that compete
Right?
for each
So
other.
if you see our little triangle here, doop, 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 and it's going to be backwards on the camera. I'm used to looking at it this way, right? Nicotinamide, NR is one enzymatic step away from NMN.
It's the second step precursor.
So it's
the way I understand
NMN,
it's
right?
first step
NR
precursor is NMN.
goes to NMN,
Right.
blah, 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 blah,
And
blah.
NAD.
And it turns out the enzyme is NR kinase
Okay.
that takes NR to go to NMN. Different tissues have different amounts of that enzyme.
Okay.
All right.
Different tissues have different amount of the enzymes for NR and NMN.
Correct.
Wow. So
So it turns out that muscle tissue prefers NR.
look at
Interesting.
that.
But retina, don't get so excited, retina prefers NMN, but not too much.
We're screwed.
All right,
We need a supplement, then we're doing all right.
No, so, and kidneys prefer tryptophan. So tryptophan is not the
Which is
salvage
an amino
pathway.
acid.
Of course
It hasn't
is.
even gone through its.
So
it
there
hasn't
is
even become a vitamin.
So it's an 8 to 10 enzymatic step to go from tryptophan up into NAD. kidneys love tryptophan. And you can actually precipitate chronic kidney disease if you are tryptophan deficient.
Wow.
Okay, right? So now what's the answer? Some tissues like NR, some like NMN, right? Brain likes straight up NAD, and kidneys like tryptophan.
Look at that.
Right? So I rotate them all.
Please tell me you're making a supplement. Are you making a supplement that we can buy and sell to
No,
clients?
but someone's going to.
Yeah.
I'm
Okay,
sure
yeah,
someone's
because
going to.
So what you're saying is, you could potentially, because this standardized dose for NMN is now for men 1,000 milligrams, generally speaking, and
5 to 1,000, 500 to 1,000, because it also depends on the CD8.
All right, so let's get to
CD8 enzyme. How much are you breaking it down?
So let's get to the CD38 enzyme. So that is sits on. It's not a receptor per se, but it's an enzyme that sits on the cell membrane of smooth muscle cells and a lot of immune cells, and it's called a CD38 ACE, or I'm sorry, an NAD ACE, because it eats up NAD, right? And it turns the NAD.
It's an enzyme that consumes it faster, or no?
Yeah. So it is turned on by inflammation,
Right.
and it eats up NAD, and it promotes more inflammation.
So poor immunity function, inflammation, gut inflammation.
Right.
If you have gut dysbiosis, it's going to suck it up faster.
Exactly. So if you are inflamed and you take more NAD, you may be more inflamed.
Right.
That's not good.
Right.
So Smith-Glaxo-Klein makes something called 78C. That is a CD8 blocker. We can't get that.
Okay.
Next best on the list is apigenin, which is a natural supplement that comes from onions and a variety of other things. So on top of taking small aliquots of each of the other things, you should absolutely take a dose of apigenin every day, because you don't want to turn entirely off the CD38, because it is a transmitter and a signaling thing. But if you reduce it by some percentage, then you're going to keep a lot of your natural NAD levels.
Sandra,
Yeah?
you have to make this supplement, and
Wait,
will
so
sell
hold on a second. So hold on. So, because look, you changed my mind on the circadian thing with NAD, and I'm humble enough to have my mind changed again. Because we recommend for women, we usually give them 500 milligrams of NMN, and for men they usually do about 1,000 milligrams.
Well,
so let's talk about how we measure it, because this is what you guys are going to get to.
We use the Ginfinity test for
now.
now.
Here's the problem with. And I love Ginfinity, so don't get me wrong.
But again, let's talk the truth. If it doesn't work,
the problem is that we can't measure several things. We can't tell intracell versus extracell, right? And no one times the day or puts the time of day on it that you are looking at.
No, we do.
Okay, you probably do now.
No. I've always said, because what made common sense to me was, hey, I want to know your levels right before that next dose. So if you take your supplements at 9 a.m., then 9 a.m. the next day test.
So I would argue that that's not the way to do it.
Okay, then what?
Because NAD is a circadian-driven thing. It is going to peak at 3 or 4 o'clock in the afternoon. You want to know what the peak level is. Yeah. It doesn't really matter what the bottom is. When it peaks, that's what you want to know.
Don't get me wrong. We tell them now 24 hours. We did change this after I learned the 4 p.m. We tell people at 4 p.m. now, if you're going to test, make sure you hit it at the 24-hour mark if you can, which I remember. Tea time.
See, British tea time, right? Right. That's perfect. So because it is a 20, and the other thing is if you take too much, right, it immediately gets metabolized into just the straight up nicotinamide molecule, NAM. That is a negative feedback for all of the other processes.
Walk me through again. It's NAD,
so
NAM.
So NAD gets converted to NAM, which goes to NMN, and then back to NAD.
Right.
So
and that's the whole
that's the salvage pathway. So if it goes to just the nicotinamide, just the NAM, that serves as a negative feedback loop to your sirtuins.
Okay.
So too much is not a good thing.
So you got to get that whole pathway flowing nice.
Yeah.
So what you should, do you agree with the 1,000 milligram standardized dose?
I think it's high.
You think it's high? So you would do what, 500 milligrams?
Yeah.
For everybody, just standardized women and men? Or?
So the answer. So here's where my anesthesiology skills come in.
Okay.
no dose is absolutely perfect for anyone. A 40, 50 kilo person is going to be different than someone that's 120.
So you would do it by weight.
And also
Absolutely.
again, as she said,
So
how much? How much inflammation? How's your immunity? So it's
how old
really.
are you? How old are you?
I got
so
it, but we need to sort of standardize it because
we have.
ways of
I
testing.
have, but it's 500 to 1,000. When you test the individual, Jin says he tested a small population of teens to 20 years of age, and he found that the baseline was 40 micromoles, and the upper limit of the quartile was 75. So because we're not 20 years old anymore, teenagers, he put and again, I don't think he has the truth either. I don't think nobody has the exact
no one has
truth.
a real answer.
Right, that's what I mean. But we're basing it as much as we can with the data that we have, right? So he says, ideally, optimally, you want it 50 to no more than 75, because anything above 75 has no proven track record that you're going to get more benefits than after what I'm hearing from you. You can actually be toxic for your brain. And it's kind of like overwatering a plant.
Correct.
You're going to kill it, right?
Yeah.
So we're just basing it off that right now.
Well, no, but also Sinclair advises on the 1,000 milligrams. So you're saying that's too much.
I think it's
No, he even does 2,000
That's what I'm
milligrams.
saying. So how many milligrams per kilo?
That is an excellent question.
Wouldn't you base it off the test, though?
I actually
now?
don't. You know what I do? I base it on someone's behavior.
Well, that's so hard.
Yeah, it's so hard to standardize
to
that.
measure.
But granted, mind, I don't have this right.
Correct.
No, that's great for you that you know your body and
Yeah,
you're
I'm not
in
saying you're
tune and you understand the biology of cells, and it's very different for you. But I'm trying to say, for the average person, I mean, as a medical practitioner, would you use the test or not, or just base it on a subjective matter on the
I will give you
individual?
a further question. When someone calls us and says, "Hey, I'm gonna go take NAD plus or whatever," like, what do you recommend? Like, okay, fine, do it per kilogram, but what do you do?
Well, so the other problem is you guys are basing this on one product. I am famous
You're
for
talking about
using
NR now.
smaller doses of many
Many.
products.
So you would do NMN, NR.
I also
Together.
I do NMN, NR, and I am straight up NAD.
Okay. Because
Every
Jin's
afternoon.
argument is
Is
that
that the NAD
is that the research shows that, as you said, the NAD doesn't go in
Penetrate the cell,
intracellular,
it
so
cannot
it
penetrate,
stays
yeah.
peripheral, and there's very little data on the
No, it
advantage
sits
of
outside.
that.
Well, so I will tell you that NAD is a extracellular neurotransmitter.
Right. He does say about traumatic brain injuries that is helpful for traumatic
That's
brain injury.
because the only cell type that has a receptor
is the brain.
is the brain.
Right. And it
So,
likes
which is
NMN.
why it's the only reason, or the only thing that I think is appropriate for an IV infusion of NAD.
for cognition
Correct.
or some kind of brain.
You have a TBI, go for
But if
an
you're focused more on sort of like the general aspect
longevity?
of longevity, energy production,
Stay
and
away from the
DNA,
IV.
and the NAD, DNA repair, it's more about NMN and NR combined.
Yeah.
With resveratrol.
Correct.
But at the end of the day, no matter the reason why the kilogram is not going to matter, because you don't really know how much your liver or your muscles need versus your brain.
You have no idea.
And then Jin only has a test. I always thought, I'm like, what is he testing? I think he's testing like whole blood NAD, and it has all these components. His product shows up. The product that we use, that's a mix of resveratrol and NMN, shows up. Like we see people typically in the 25, 30, which they're basically deficient. So as a medical doctor, will you at least use that test as a reference line? Or
it just depends on the patient. Some people, like, it's sort of like looking at your telomeres. Some people are data driven and they want to know exactly.
Right.
I don't make any decisions based on that data.
Gotcha.
Right? Because it's just not good enough. Now, if I'm treating your cholesterol, oh, hell yeah, right? A number's a number. If you're anemic, if you're this, if you're that, we know exactly what those numbers mean.
Right.
This is all very new. So if someone is extremely data-driven and they come to me and they want to take it, fantastic.
Right.
But as a medical clinician, especially as an anesthesiologist, I am more about the story.
Right.
Yeah.
And I will tell you that women in their mid-50s come in, they are exhausted, they can't see, their back hurts. I tell them, keep track, make a diary. Within 10 days to 2 weeks, and I usually give them like a little bit of a bolus and then back it off and then put, create a reasonable program. Within a month, they come in like, oh my God, my energy levels are great. I'm sleeping better, blah, 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 blah. Everything is better. And you go, fantastic.
Yeah.